Continuing with the prolonged pregnancy from the previous video. In this video we will be covering about the fetal surveillance, induction of labor and prolonged pregnancy, and intrapartum problems and their management. So firstly, about the fetal surveillance. Fetal surveillance is very important during the whole antenatal period, and it is necessary to start antepartum fetal surveillance from 40 weeks of gestation. So by doing fetal surveillance, we can identify the fetus which is at risk, and in such conditions we can induce the labor early which will be beneficial for both the mother and the fetus. Usually the risk to the fetus usually increases after 42 weeks, but in some cases risk also increases between 40 and 42 weeks. So usually more than 42 weeks there is increased risk for the fetus, whereas in some cases it is seen from 40 to 42 weeks itself. Now coming to the antepartum fetal surveillance. There are many methods for antepartum fetal surveillance, some of which are monitoring the fetal kick count, so some of the ways for counting the fetal movements include the pregnant woman is asked to count and record the time taken to perceive 10 fetal movements and note it down. So if it is more than 12 hours, even then she is not able to perceive 10 fetal movements, then it is considered to be abnormal. And one more method is, so the pregnant woman is asked to count the fetal movements for 1 hour every day. And also there is one more method where the woman is instructed to count fetal movements for 2 hours every day. So if it is more than 10 movements in 2 hours, it is considered to be normal. These are the various methods for counting the fetal movement. So the next test will be the non-stress test. And the biophysical profile. And modified biophysical profile, which includes non-stress test along with amniotic fluid index. So we will see about all these antepartum surveillance in another separate video. So out of all these tests, the biophysical profile, that is especially the modified biophysical profile, is considered to be more reliable and it is done in all patients whose gestational age is more than 41 weeks. So, after seeing about the fetal surveillance, now coming to the induction of labor. Induction of labor is usually done between 41 and 42 weeks to decrease the perinatal mortality. The induction of labor can be done by methods like stripping or sweeping of the fetal membranes. This acts by increasing the endogenous prostaglandin secretion from the cervix, and this is usually done at 38 to 40 weeks. And other methods include ripening of cervix with prostaglandins. Here prostaglandin E2 gel is inserted into the cervical canal and it is reassessed after 6 hours, and if needed, second dose of gel can be introduced. And other methods for inducing labor include using Foley's catheter and inflating it, or inflating the balloon at the level of internal os. So, and this inflating a balloon at the level of internal os has been found to be an effective mechanical method of induction without an increased risk of infection. So, this is about the induction of labor. Next, coming to the intrapartum problems and their management. So, first, the problems which can arise include there could be possibility of fetal distress, and the oligohydramnios can predispose to cord compression and in turn fetal distress. Then there will be meconium staining. Because of the oligohydramnios, the meconium will become thick and tenacious. And large babies are born because of prolonged pregnancy, which can lead to prolonged labor. These are the problems. Now, let us see the management. So, if possible, we should do electronic fetal heart monitoring to diagnose fetal distress at an early stage, and fetal heart rate should be assessed during and immediately after a uterine contraction. If it is found to be abnormal, then immediate delivery of the fetus is indicated. And any shoulder dystocias should be detected early and any trauma during delivery should be avoided to the maximum extent possible. And then there should always be a senior obstetrician present at the time of delivery to hand the shoulder dystocia, which can present at any time during the labor. And at the time of labor, care should be taken to prevent meconium aspiration syndrome. So, this is all about the prolonged pregnancy. Thank you.